Hello guys, welcome to another episode of Nashty. It's about you and me. So you're probably wondering why I don't have my shirt on. Well, because today, for the first time in my vlog, I'll be tackling a very sensitive issue, at least for men who have it. It's called gynecomastia, or in layman's terms, man boobs. So, not everyone would really talk about this topic, especially something sensitive such as this one, for many reasons. And I personally thought that it would be great to give my thoughts about it, about gynecomastia, about gynecomastia surgery, and how it affects one's life, one's confidence when you have such condition. What is gynecomastia? Gynecomastia, or man boobs, is an endocrine system disorder where the breast tissue overdevelops and becomes, very prominent. It's non-cancerous, but the thing is, for many men who have this condition, it comes with psychological distress, for obvious reasons. Like, if you're a man, society expects you to have, a flat chest, not a big, saggy breast. So that's one. The thing is, you may think that gynecomastia is not that common at all. But studies show that it is actually quite common. In fact, it develops in up to 70% of adolescent boys. And even newborns. So this means that about 70% of the world population would have this condition. Not necessarily like they will still have it when they're already adults, but many of them would go through this phase and would have it for quite some time, and then such condition would disappear. So what's the reason behind it? Well, there are many causes of gynecomastia, but the most common one is hormonal imbalance. So meaning like the estrogen-androgen ratio in your body is not balanced. Sometimes, your estrogen shoots up and then your androgen goes down. So with that, normally gynecomastia could be a side effect. What are the signs and symptoms of gynecomastia? So you may think that any guy with large breast or big chest would have gynecomastia. That's not always the case. Some have this what they call pseudo-gynecomastia. Sometimes it's just puffy nipples. As long as it does not have like a glandular tissue under the areola, then normally it's not considered gynecomastia, especially if it's just fats. So how do you know that you have one? So normally when you try to examine your chest or breast area, you'd see that the enlargement is soft, it's compressible, and it's something that you can sort of like touch, and for some reason you can isolate it from your pectoral muscles. Like it's like not part of your pectoral muscles, it's more like above it, right under your areola or nipples. So I think some would have like milky discharge, but of course in most cases there's none. Another thing is that it could appear in just one of your breasts, so that one would really look awkward, to say the least. It doesn't look good, but for many it occurs on both breasts. Okay, so and with this, males can be anxious or stressed because of how they are perceived by people around them. Like, the expectation is if you're a guy, you don't have like a big breast, at least based on, you know, on experience on people I've talked with, they're not happy when, you know, once their girlfriends or, you know, their wife would find out that, you know, they have even like bigger breasts than their, you know, their significant other. So another thing is that people who have this condition normally cannot take their top off, especially when they go to the beach. They said that the only time they could, you know, go to the beach or do some swimming is at nighttime because people cannot see their chest. So there. It's also hard to wear some types of clothing, especially like white ones, or those that are very sheer. Not all people with gynecomastia would have the same size or appearance of breasts. In fact, there are several grades or forms of gynecomastia. It starts with, you know, grade 1, where it looks like you just have like puffy nipples, but really there's like a tissue inside it. Up to grade 4, where your breasts are already sagging and is usually coupled with, you know, fats. So, and you know, normally grades 3 and 4 would be similar to women's breasts. So the question now is, how do you avoid it, or how do you get rid of it? Well, for those who don't have it yet and who are still about to undergo puberty, well, it really has something to do with the hormonal balance of your body. This is excluding like certain conditions or diseases that, you know, people have that would trigger gynecomastia, but in normal circumstances, it's usually caused by hormonal imbalance. So even if you know, develop gynecomastia, once the imbalance balances out, so it would disappear. But for those who don't, then the only way to correct this, to remove gynecomastia, I'm sorry to say this, is through surgery. You know, they say that you can, you know, try this turmeric like powder, and then it would destroy the breast tissue. And there are several other supplements available online which claim that, you know, after 2 months of taking it, your, you know, breast tissue will get smaller and that gynecomastia would disappear. But really, guys, you're just wasting your money. It's not true. The only way to truly remove, you know, the glands, gynecomastia itself, is through surgery. What kind of surgery? Well, they call it subcutaneous mastectomy. So subcutaneous, it's beneath the skin. So is it a major surgery? I think so, because, you know, once you go into surgery, normally they would require you to be on general anesthesia, but some said they can do it under local anesthesia. So, but for me, I think it's still a major surgery, because, you know, before you get the clearance to undergo surgery, you would have to undergo different tests. Let's talk about gynecomastia and gynecomastia surgery in the Philippines. I know a lot of you, especially Filipinos, would want to know where they could seek treatment, like which doctor do they go to, like how much does it cost. So these are the usual concerns that, you know, people who have gynecomastia have. So let's start with the kind of doctor to go to for you to get, you know, an evaluation or a checkup. So of course, I believe the only doctors who treat this kind of condition are surgeons. In particular, these are plastic surgeons, reconstructive surgeons. There are several Filipino surgeons known for their, you know, for gynecomastia surgery. And then if you don't know any of them, you can always go to several, you know, clinics. You know, normally these are the plastic surgery clinics that are quite common, especially in Metro Manila. So I don't want to name names, but of course, once you search them, type them on Google, they would already be there on the search results. As for the cause, again, it varies widely depending on who you talk to. Like, I've heard that the cheapest one for the surgery is 50,000, and it could go up to 150,000 pesos. So just choose who you think would give you, better results. You can always look for their portfolio online, see people who they have, operated on. Let's talk about the surgery itself. As I've said before the surgery, you have to undergo some form of clearance. So there's like blood test, ECG, X-ray, those things. So once you're done with them and you pass them, then you're now eligible for the gynecomastia surgery, or what we call subcutaneous mastectomy. Normally, it's an outpatient procedure, meaning, you don't need to be confined. But some doctors would, prefer that you be confined, because for other patients, like after the surgery, they could not just, easily walk, because especially those who were under general anesthesia, they're like sort of groggy. So confinement is, preferred for these people. But again, it can always be done under local anesthesia, so you can just, go out of the hospital or the clinic after the surgery. After the surgery has been done, of course, the surgery would involve excision of tissue. Others would do some liposuction in the chest area. After the excision of the glandular tissue under your areola, your nipple, you'd get like sutures or stitches under and on the actual excision area. So once you go out of the hospital or clinic, normally you're given like pain relievers for 2 or 3 days, and then 5 weeks after the surgery to up until a week, you have to go back so that the doctor could remove the sutures, and for those with drains, they have to be removed as well. And then for at least 2 weeks, you'd have like an elastic bandage like covering your chest area, so it's compressed, so you'd really feel that something is being constricted. And then you'll also be asked to wear a compression vest or garment. So some doctors or clinics provide it, but if they don't, you can easily buy one online in online shopping stores. So during that time, you're also asked to do some massages. The reason for it is so that you'd prevent the scar tissue formation. At the same time, you don't want seroma to accumulate within your chest area. What is seroma? It's basically a fluid that that is supplied by your body to that area where the excised tissue came from. So basically, that's a hollow area, and that hollow area is where the seroma accumulates. It's like a mixture of blood and some bodily fluids, probably like plasma or something. So that's also one of the reasons why you have to have like an elastic bandage and a compression garment, so that even if seroma occurs, it's not gonna be much. So there. And aside from that, you have to do some massages on your chest area so that when the wound heals, it becomes, much nicer and much firmer without much scarring. So there. You may be wondering why, I'm tackling this topic, why I know so much about it and why I'm passionate to share this to you. Months ago, I underwent surgery. I decided to keep this from most people except for my parents. So it was, it was like a one-day procedure. And I was really excited to do it, but at the same time scared because it's like my first major surgery. But despite my fears and my worries, I'm also very happy that that I actually did it. It felt liberating. I immediately felt like my confidence, my self-esteem is back. So that's how I personally felt about this procedure. The first time, the bandages were removed, then I saw my chest area. I was like very emotional because, for the longest time I've been having, this condition, and then all of a sudden it's gone. So towards the end of this video, I'll show you some, before and after photos. I'll also share with you how large the tissues that were removed from my chest area. And in the coming days, I'll be sharing more vlog episodes about, my gynecomastia and gynecomastia surgery experience. It's a journey. It's not something that, goes away right after surgery. Of course, the tissue is now out of your body, but what I mean is, it takes up to 1 year for full recovery. So the advice is, after a month of surgery, you can now go back to, exercising, working out. You can now lose as much weight as possible so that you look good as well. Yeah, but basically this is my experience, and I just want to share it to you guys because I know a lot of you have been looking for a solution, to end your gynecomastia problems. So I hope, this vlog episode has helped you in one way or another. And don't worry, as I've said, I'll be posting more vlog episodes regarding this one. Okay, so this is the first time I'm doing it. I'm actually showing you guys my chest post-surgery. It's been 2 months since I had my gynecomastia surgery. So if you look at it now, it's still not looking perfect, but it's definitely looking way better than, pre-surgery. If I sort of like make muscle, you would see here this line. This line, everything under this line used to be the glandular tissue that was removed. So now it's still healing. So I'm hoping that I develop more muscles beneath it so that it would look perfect. I also had like my liposuction. So as you can see, this dot, this is a scar from the liposuction. Also here on the other side, here, there. So if you look closely here, you would see like the scarring of the surgery itself, the excision. So yeah, it used to have like sutures there, but now of course they're gone, but there's a scar. I am putting on like scar removers. The doctor told me that I should use scar remover for 6 months. So hopefully after 6 months, the scar gets, well, I don't think it would go away, but at least the appearance would not be as pronounced. So there you have it, guys. So this is the first time I'm doing this. I'm actually quite conscious and, you know, a bit shy. But, you know, as I've said, my goal here too is to educate you guys, to inform you, to tell you that, you know, having gynecomastia is not the end of the world. There's something that you can do about it. Yes, it entails having some money, but money, it's something that you can earn, something that you can save up for. So, and in the end, I think it's always gonna be worth it. Well, thank you so much for tuning in. If you enjoyed watching this video, don't forget to give it a thumbs up. And if you're new to my channel, please don't forget to subscribe. Always remember to be nice. I'm Nashti. Till then.